Hello everyone. Today we will discuss thyroid gland, in which we will discuss anatomy, physiology and disorders related to the thyroid gland. Now let's start with anatomy. It is just situated on the thyroid cartilage, which is present on the center of the neck and in front of the trachea. It has one lobe on each side, and these two lobes are linking with isthmus. Isthmus is something which connects two major tissues. Shape of thyroid gland is just like a butterfly, and there are two beads like structure on each side, that is parathyroid gland. If we'll see the histologically, then it is composed of hollow spheres or follicles. These follicles has jelly-like compound that is called colloid. Now let's talk about biosynthesis, storage and transport of thyroid gland. These follicles have great ability to excrete iodine from the blood, and this process is called iodine trapping. Means that follicles will excrete out the iodine. This is an active transport mechanism, means it requires ATP. It is stimulated by thyrotropic hormone from anterior pituitary gland, means TSH. It will stimulate this process. Then this trapped iodide is converted into iodine in the thyroid follicles. Iodide will convert into iodine. Then this iodine will combine with amino acid tyrosine to form MIT and DIT. MIT means monoiodotyrosine and diiodotyrosine. This process is take place at third and fifth position of tyrosine. And the next step is coupling of MIT and DIT. These molecules will couple and ultimately form thyroid hormone. If two DIT molecule will couple, then it will form thyroxine, that is T4, tetraiodothyronine. If one MIT and one DIT molecule will couple, then it will form T3 hormone, that is triiodothyronine. And this T3 and T4 will stored in the colloid of follicles, and in colloid it will bind to the thyroglobulin, which is higher size protein. These T3 and T4 are released in blood, and it will detach from thyroglobulin. These released T3 and T4 are bound to proteins in plasma, that is called thyroxine binding alpha globulin and thyroxine binding prealbumin. Here T4 is bound much more firmly than T3. So what happened? T3 is quickly acting and short acting, while T4 is slow but has longer acting. T3 is also synthesized from T4 by just removal of one iodine molecule through the help of deiodinase enzyme. If there is a lack of one iodine molecule from T4, then it is called T3. In fact, it is the major source of T3 in the body. T4 is the major source. Both T3 and T4 are metabolized in liver and some of the peripheral tissues by two processes, deamination and decarboxylation. And finally, it will form metabolites like triiodothyroacetic acid and tetraiodothioacetic acid. Tri and tetraiodothyroacetic acid. And finally, these two metabolites are excreted from urine. Now let's talk about functions of thyroid gland. It has many functions. We can say it will regulate all over the body. It has calorigenic function, means it will increase oxygen uptake, calorie production and BMR, basal metabolic rate. It has also effect on metabolism, means it will stimulate the metabolism of carbohydrate and protein. It will stimulate the growth. And if we'll talk about mammary glands, then it will secrete, it will increase the milk secretion and fat contents are increased. On heart, it increase heart rate, means if these tachycardia and palpitations are common signs of hyperthyroidism. Tachycardia means increase in heart rate, and palpitation is also one of the sign of tachycardia, means it has higher rate of heart rate. Then on kidney, it has a effect like diuresis, means it will increase the urine output. It will excrete nitrogenous and creatinine products. And it has also effect on release of calcitonin, means it will increase calcitonin effect, and it will lower the concentration of calcium ion in the blood and causes deposition of calcium in bones, means it will increase the concentration of calcium in the bone, and ultimately it will strengthen the bone. Now next one is disorders related to thyroid gland. It means if any deficiency will occur in thyroid hormone, then this hypothyroidism and hyperthyroidism will occur. The name itself suggests, like if hypo will happen, then something which is decreased. Here thyroid hormone will decrease, and in hyperthyroidism there is increment of release of thyroid hormone. Now let's start with hypothyroidism, means decrement of thyroid hormone. It will develop due to deficiency of thyroid hormone. As I told you that it will decrease the level of thyroid hormone, and if it will happen in children, then it is called cretinism, and if it will happen in adults, then it is called myxoedema. There are two names. If hypothyroidism is happen in children, then it is called cretinism, and if it is happen in adults, then it is called myxoedema. Now what happen in cretinism? The symptoms are like child is retarded in growth and height, means the height of child become reduced, and the face is look like bloated, the face is swollen, and BMR is low, the metabolic rate is low. And if it will happen in pregnant woman, then child born may have these abnormalities. In myxoedema, patients have puffy face. Puffy face means swollen face. It looks like swollen with filter paper like dry skin. It is the skin become extremely dry, and scanty hairs means hairs become scanty and very thin and fragile. There is slow speech, then decrease intelligence, amenorrhea. Amenorrhea means decrease in menstrual flow, and slow pulse. Then another one is goiter. Goiter is a condition in which necks get swollen. The neck portion where the thyroid gland is situated will become swollen, and this is due to iodine deficiency. Then another one is hyperthyroidism. In hypothyroidism we have discussed three things: cretinism, myxoedema, and goiter. Now in hyperthyroidism there is increment of release of thyroid hormone, there is increased thyroid hormone, and it is also called Graves' disease and exophthalmic goiter. There are two names of hyperthyroidism: Graves' disease and exophthalmic goiter. Why it is called exophthalmic? Because here the eyes become bulging out in patient. The eyes become bulged, means it looks like the person is staring someone. Eyelids are also drawn up. The weight is rapidly lost, means if someone is suffering from hyperthyroidism, then they will become skinny. And mind is anxious, means person become confused. Skin is soft and red. Heartbeat fast, means increase in heart rate. Plus you can also find person with palpitation, rapid heartbeat. Muscle shows tremor means there is shaking will occur, means person have shaky hands. And urine also contains sugar. You will found sugar in urine. So this is all about thyroid gland.